I also, oh, the last thing is I'm a big fan of dialogue. Feel free to raise your hand, ask questions, interrupt me. I have no problem with that. I'm one of 7 kids, the 6th of 7 kids, so I'm used to getting talked over and speaking up louder. So I'm not, no problems with any interruptions. So, and just full disclosure, if I look at you guys staring straight ahead, I can't look at my slides. So if I'm looking sideways, that is why. So first slide here is obviously just the title. What I wanted to note is on the left well, federal government speaks, so I'll try and get into this a little bit, but we're not allowed to have logos except for the EPA, but for our center, we have a graphic identifier. So we're the Center for Computational Toxicology and Exposure. And what we tried to reflect in this is, the work that we do with, the DNA work, the high throughput screening work in this top, I don't know if you can see my pointer, but we also do a lot with eco, so that's what the fish is for, and they're doing new approach methods there as well. And then exposure, so doing things, and I'll talk a little bit later about what new approach methods are, but let me know if it would make more sense for me to define it now. And I left this on here, the EPA at 50, we just celebrated our 50th birthday on December 2nd. So I thought that was a nice little thing to share. So happy birthday to EPA. Okay, so this is the United States. Next question. No, I'm just kidding. So I did this, so trying to find a way that wasn't boring to talk about my career path. But so I went to Bates College up in Maine, graduated in '94 with a bachelor's in science, just a biology, focus in immunology. No idea what the EPA was at that time, had no plans on going to it. Went to grad school in Buffalo. My degree there, and I always bring this up because my degree is in dental research. My PhD and my master's are both in oral biology. So going from Bates, actually my mentor at Bates, her husband was a dentist. They met while she was getting her PhD at Buffalo, and he was at dental school there. So it was sort of some of our research tied into periodontal disease. So it just sort of fell out that way. But when I went to SUNY Buffalo, they had a program called the Center for Advanced Molecular Immunology, and I was able to shop around. And so I know you guys are all already in graduate school. Oh, look at that, I'm spotlighted, thank you. All the tricks of Zoom that I don't know, we use Teams. So
I think it just helps with the recording. It puts you in, when I get the video back, it puts you
in. Okay. So yeah, so I went to SUNY Buffalo not planning on going to dental research, but they were doing genetics of immunology and they had more money, and so it just seemed to make sense. So I jumped in there and did that for a few years, and then when I decided to leave, the job hunt sort of was weirdly split between continuing with dental and maybe even becoming a dentist versus going on and doing what I had wanted to do in my head, was immunology related to cancer. And so I chose the cancer path, which sounds bad when I say it that way, and ended up in Morgantown, West Virginia at the Centers for Disease Control's National Institute for Occupational Safety and Health. And the postdoc I did there was a National Research Council fellowship. And it was doing these neat new things called microarrays. So it was when that was just getting started. Again, I followed the money. They had a lot of funds to try and start up this program. And I was like, great, that sounds interesting, I'll do that. So while I was there, I started specifically on occupational exposures, looking at gene expression patterns and susceptibility to breast cancer and lung cancer. And then of course, as you're doing cancer research, you start picking up more and more about toxicology. You sort of can't not, right? I mean, they sort of go hand in hand. So when I decided to leave West Virginia, I had been, since grad school, just in the government. I applied to jobs both in the private sector and, no offense, Angie, not academia. I didn't really want to do that. I like teaching on a one-off. I don't like doing it forever. And I ended up deciding to go to DC, which I always joke that I'll go to DC, get a job. It's acronym soup. I can find a federal job if this one doesn't work out. So ended up at the EPA doing risk assessment, which I knew a little bit about, but hadn't really done anything with. And so it was a great transition of, so I'm part of why I'm mentioning it this way is because it was yet again another departure, right? Like I went from dental research to cancer research, and now I'm doing toxicology and risk assessment. And so I always of the mind that as long as you learn the foundational aspects of science and asking questions and how to find answers and do research, you can pretty much do anything within reason. So I jumped into risk assessment wholeheartedly. I went and did the training course for getting certified as a toxicologist. So I got my DABT in whenever, I can't remember, 2008 maybe. And love the EPA, love the mission, love everything about it. I think what we do is hugely important to not only the US, but the world. I mean, we're very impactful in a lot of ways that people don't always know about. So stayed in DC until 2019, and then I stayed with the EPA, but came down where I am now into Durham, North Carolina. And the reason for that move was we reorganized our entire office, the Office of Research and Development, and they needed a supervisor down in North Carolina to supervise some of the lab work that's being done on the new approach methods work. So they asked me if I would take the job, and I said no a few times because I didn't want to leave DC, but it was too good a job to pass up. So here I am now, 2021, still here in the same little apartment that I can't leave ever because of COVID. So I always joke it's the year that never was, because I got here in October of 2019 and threw myself into the job. And by spring, I was going to explore the state and everything around me. And then spring, everything shut down. So, so that's where I am now. And then the next, I think it's the next slide, I sort of, and again, this was a refresher. And then I'll talk about what my jobs, so going back to the, the map of my path. So technically I've been with the US EPA since 2006. And if you look at my federal career record, I've been a biologist. That's it. That's all it says. I have a slide coming up that shows that all the different jobs I did while in that job. And so it's always good to sort of explore and stretch yourself, I think, at least for me. I mean, some people prefer to do the same and be that expert in that narrow field, and we need that as well. But I like to sort of jump around and see the different options. And so I was segueing to this slide, the US EPA Organizational Chart. My understanding is most of you, or at least Chris Lau, presented to this group weeks or months ago, and he's also in the Office of Research and Development. The only reason I'm showing this slide is just to give you a sort of the spectrum of how EPA is set up. So we have an administrator who hopefully will be confirmed by the Senate next week, which is great for us because that allows us to do more things. And then we have all these different sort of topic specific offices. So these are all different offices. Office of Research and Development obviously is the one I'm in, but air and radiation, water, land and emergency management, you guys are likely familiar with because of Superfund. But these are all sort of broken down by, in many cases, the mandates that they're responsible for and the regulations they're responsible for. So the work that we do is mostly tied into the Office of Chemical Safety and Pollution Prevention, which is the main, there's a lot of other regulations there, but TSCA is the main mandate that we deal with, as well as FIFRA, so Toxic Substances Control Act and the fungicide, insecticide. Oh, I forgot one. Angie, do you remember my Rodenticide Act? I'm missing an F. Sorry about that. But so pesticide regulations. So again, not going to quiz on any of this, but I just wanted to point out when I start talking about our program partners, that's what I mean. They're internal to EPA. We tend to talk about them as program partners or stakeholders, but stakeholders can also mean, outside entities and NGOs and things like that, non-governmental organizations. And then just to note, we have regional offices in every, across the United States. And so the headquarters are as shown here. I don't think anything else is needed on that. And then, so I briefly and Chris may have touched on this, but the mission for our office for research and development is, again, to provide the science and technical support, technology, tools to inform EPA's mission to protect public health and the environment. It's fairly straightforward. We wanted it to be, because we just rewrote these. So we wanted it to be very clear that, science is important to underlie all the regulations and decisions that we make. This is where we are here. I am here in North Carolina, and then we also have a larger research facility in Cincinnati. We have sites across the United States and other locations, but the largest lab facilities are in these two locations. So, all right, so this, again, no quiz later. But so when I talked earlier about I've been with EPA since 2006 as a biologist, in that time, again, I'm not going to read through all of this. I've had, I should have counted 1, 2, 3, 4, 5, 6, 7, 8 different positions. So some of them are sort of official changes in duty. So like the job I have now as a division director was an official change. So now I'm actually a supervisory biologist, but still a biologist. But like when I first joined, I was a biologist in what was the National Center for Environmental Assessment, doing risk assessment. And then I went on what we call these details. So I don't know if Chris talked about those. I don't know if he's ever done one, actually. I hadn't checked with him. But so by that is when you get loaned out to another part of the agency. So either they have a specific need for your expertise, or you're really tired of your boss, or they're really tired of you, they can sort of rent you out to another part of the agency. So you're still officially in your job. That's your position of record, but you can go and try sort of new different things. So for me, you know, the first one I did, I was really looking to get a broader view after 5 years of doing specific risk assessments. And I won't get into a lot of that job, but like I worked on an asbestos one, and I worked on trichloroethylene, tetrachloroethylene. These are things tied into Superfund very closely, right? So I'm sure a lot of that's familiar. But so I went and worked in our, what we call sort of our immediate office for the National Center for Environmental Assessment. And that's where the leadership sort of sits. So I was assistant center director for risk analysis, which meant I oversaw all of the risk assessments and some of the key science issues we had. And so it was, again, it was in a perfect world, the detail is supposed to send you somewhere that where you can bring some expertise that they need, but you can also learn a lot more and you gain some expertise. I think details are great. I think everybody should do them. I mean, you can't do them all the time, but I think you gain a lot personally in professional development, but you also can bring a lot back to your sort of home office. So I jumped from there to this other one, which was another huge departure for me, was this Associate National Program Director for Community Public Health in the Sustainable and Healthy Communities Research Program. So I didn't get into it, and I don't know that Chris would have, but we're in a sort of matrix system where we have our Office of Research and Development, and within there we have the different centers. So the one I mentioned, CCTE, the one I'm in, Chris is in a different center. He's in the Center for Public Health and Environmental Assessment, or SOPHIA. So ORD has, I should have done an org chart after all, has all the centers, and then overlaying that, we do our strategic research planning through these national programs. The one we work with the most now is Chemicals for Safety and Sustainability, CSS. This SHC one does more on environmental justice and children's environmental health. They are tapped more into the Superfund work that we do. We have a little bit of that, but not nearly as much as I think we should actually, and hope to have in the future. But anyway, so this was a detail that I got asked to do because they needed somebody who had a human health background, and I was told could herd cats because it was a difficult group of people that they were trying to get to work well together. So I did that for 2 years. It was a great experience, and it was, again, my underlying theme here is it was a huge departure for me. It was a whole new field and language in some ways, and the first 4 months were misery. I kept asking them if they wanted me to do it, so I quit because they wanted to get rid of me, because I was like, why would you do this? But it was great to try something new, and I had the safety cushion of knowing it was a detail, and if I hated it or it didn't work out, I could jump back to where I had been. So a couple of the other ones I won't really get into. I then jumped over to the immediate office of our assistant administrator. So we have an administrator that's confirmed by the Senate, and then he selects leads for all the program offices I mentioned. So for ORD, that assistant administrator is also generally Senate confirmed. When I worked there, the poor guy, Tom Burke, who's the dean of the School of Public Health at Hopkins, he tried to get confirmed. He was nominated, but it was a different time of politics, and so he never got enough votes. So he worked in the position as a deputy for as long as he legally could, and then we had to fill somebody else in. So anyway, so I worked there as a senior science advisor to both the deputy and then also the assistant administrator. And in that, amazing, a great opportunity. It should only be, I mean, it's a lot of work and it's great exposure, but it really should be something that's rotated, I think. And the office thought that too, because you get such great experience and then you can apply it and somebody else gets that opportunity. But this was overseeing all of our research in ORD. So I got a better handle of all of the work in air and in water and Superfund, not just the things I had been working on in risk assessment. So, and just got to see sort of how the sausage was made and how decisions were impacted by politics and policy, and you know, how to communicate what you want to do in a way that, and you guys, whatever direction you guys go, if it's, you know, academics, you need to write grants, if it's federal and you want to get appropriation funds, or if it's industry, which I've not done, so I'm sure there's the same path. Knowing how to sell your work is key. And so knowing how to sell it for us related to the underlying politics is really important as to how to sort of frame things. And then when that administration was over and my boss retired, I ended up starting being a senior science advisor for the group I'm with now, and then down here as a division director. So any questions there? I know I'm talking a lot. taking more time than I thought, so I apologize. But all right, so getting into what I'm doing now, and that gets into the NAMs and some of the PFAS work. So I'm the division director for biomolecular and computational toxicology. Since we haven't seen each other since March, really in person, I sent out a New Year's card to everybody. So this is my division of the time. If you note here, this is my cat, because he is part of the division. He is de facto. But it's definitely been a year to remember. The reorganization of our office in ORD was a huge upheaval. It took place October 1st, 2019. So we had a few months to try and get settled, and then COVID hit. And then we also, the building is being renovated. So it's been a lot of fun, let's say. It's been a good learning experience. But anyway, so this group of scientists, some of them, if I mention their names, you might know them. I mean, they are amazing. It's why I moved to North Carolina. They are great to work with. They are brilliant. They are innovative, and they just are committed to what EPA is trying to do. So our mission is, so when we talk about new approach methods, they were often called these alternative tox testing strategies or whatnot. We always like to come up with new acronyms. So in 5 to 10 years, it'll be called something else, but it's basically trying to find new ways to understand, in our case, human health toxicology, but we do it for eco and for exposure, and avoiding the use of intact animals, basically. Trying to find a way, not just, I mean, there's a couple of benefits there. It's the ethics of doing animal research, but also trying to do things quicker, faster, better, so that we can inform risk assessments that much quicker. It's a balance of, if we can do these new approaches and get, high level answers, screening or prioritization answers, then we can assess that many more chemicals in the same time frame using less money, less people. It's just, how do we protect public health better? Using our new skill sets and our new technology. So the mission is, expanding and refining the development of these types of assays. So when I talk about high throughput screening assays, for our tier 1 testing, we're looking at doing thousands to tens of thousand chemicals in, a couple day period. And then the biggest lift is the bioinformatics. I mean, at this point, not to discount this process and the development of the assays, because that does take work, but once they're in place and we've been able to run through them and can try and evaluate the performance of them, we get a lot of data, and we have to find how to parse it out and develop it in a way that people can use it in risk assessment. So that's part of what we do. Sort of the complex cell culture systems and alternative species models. We have zebrafish work going on. We have organoid work and microphysiological systems, where we're looking at developing sort of 3D tissue systems in an in vitro assay. And I don't know how many of you do anything with that. I don't know how much of this is new or old, but so those are more medium throughput in some cases, but they're still, faster than what we had been doing before. And we can get a lot of data and information about chemicals that we wouldn't have had before. And then we also do computational models. And then, as I mentioned, the informatics approaches. So to analyze the data. And again, trying to apply this to chemical risk assessment so that we can go to, and I'm touching on Superfund where you guys are focused, but we work with the OLM office, which is the Land and Emergency Management, a lot to say, what are your chemicals of concern? What are the questions you need answered, and how can we do it in a quick way? And so a lot of that relates to screening and prioritizing chemicals in a Superfund site. Like, what is the main driver? Like, if you have a list of 20 chemicals, usually most of them don't have any data, right? So what can we find out from our predictive models or from our in vitro assay screening efforts that can give you any sort of information? So if you have something on there that it's lighting up as a potential carcinogen, then obviously you're going to want to look at that, and that might be the driver of any decisions for that Superfund site. So that's an area we work with them on how to help inform those decisions for them. And as you guys likely know, Superfund is, all of our regulations are, but particularly Superfund, we have to be able to defend anything we do in a court of law, right? The decisions that are made have to be backed up. And so we spend a lot of our work as well on, I hate to say the word validation, but that's basically what we're trying to do, how to validate these new methods and evaluate their performance in a way that people accept the uncertainties that you'll see. And not to go too far off that track, but one of the things that started with these new approach methods was talking about, are animal models truly the gold standard, right? So we've used them for years. We know there's uncertainties, but we accept those. And so under amendment in 2016, they are required, they being the agency, so me, required to look for alternatives to animal testing, but it has to be shown that that alternative is as good as or better than the animal model or the traditional assay. So what does that language mean? I mean, it means one thing for the legal side, but for the science side, like how do we show that we're as good or better than, you know, a rat model when we don't really have that data? It was just tenfold uncertainty factor. And so we're doing a lot of research on that as well as, you know, so we're taking this in two tracks, right? We need to build confidence in our methods. And the best way to do that is to show what level of uncertainty was accepted and, you know, what we could get, what was the concordance between animal studies using the same materials and that. So we have a lot of different tracks of research in our group that are sort of attacking it in two different ways. Like, so building up reference chemical lists that we know our expectations of how they would react, and we run them through our systems and we use that as a performance evaluation. But then also looking at, is that better than the animal model? You know, yes or no. And you can imagine there's a lot of politics tied into this in a lot of different ways. Anyway, that's another rabbit hole. That's a whole other talk we could give. But and then so that fits into trying to broaden the acceptance and implementation of these methods to support regulatory decisions. These are names. Again, not going to quiz you on it, but we often get questions about what are new approach methods. As I mentioned, they're basically alternative tox testing. We just changed the acronym because we could. It's tied into a workshop that was held by EPA related to REACH, so the Environmental Chemical Agency, in 2016. And that's when they started using that term, and we sort of picked it up and have built off of that. We have, you know, it's in silico, it's in vitro, it's, you know, in vitro toxicokinetics. As I mentioned, we're doing not just the sort of response, but exposure work we don't have on here. You know, using computer models to integrate different computational or in vitro data streams to come up with sort of a yay or nay. A lot of what we did early on was related to endocrine disruption and pulling in data from a variety of these different assays and some computational predictive models and coming up with, yes, this is something that we have a concern for it being an endocrine disruptor. So you might want to raise that up on your testing or focus. And then a part of this, I mean, it's all about the data, right? I mean, we're developing a lot of data, but we're also trying to find better ways to incorporate our work with the traditional data streams. And so we have I think I have the link on one of the slides, our CompTox chemicals dashboard, where if you plug in a chemical, you get not only any new in vitro data that we have in those data streams, but the traditional, and if it's been used in a risk assessment, you'll get those toxicity values and all of that in one spot. So that's a big part of yet another piece of what we're doing. Oh, I did have this in here. So I mentioned earlier about the sort of tiered testing approach where we're talking about high throughput screening, which is tens of thousands, hundreds of thousands of chemicals screened at once. And so a lot of our work here is focused on doing high throughput transcriptomics. And I don't know if you're familiar with that, but doing in a like 384 well plate chemical, we can do dose response for looking at the sort of gene expression differences. And we have work ongoing. Rusty Thomas, who is our center director, had worked on this 10 years ago, and it's continuing, where looking at using those gene expression changes as a point of departure for risk assessment and what that would look like. And so we're doing a lot of work on that. There's a recent publication, and I should have linked it here, describing the HTTR method, this high throughput transcriptomics that was just published in Toxi, I think it was Toxi like a week ago. We just got it finally. And what this method looks like and how we would be doing the data analysis. In one, we use MCF7 cell lines, but we're doing other cell lines as well. And then we're continuing to work on how to apply that as a sort of a risk assessment feature. And then, you know, the tier 2 is this orthogonal confirmation. So looking at different in vitro assays that can confirm what we had seen in the screening, still medium to high throughput, depending on the assay, but trying to dig in more, a little bit deeper. Like you see what pathway we're interested in for this chemical. What would that mean with these other targeted assays? And then farther down, looking at higher levels. So it's more, you know, maybe medium throughput might not even be a higher throughput method, but looking at the organoids or developing 3D tissue systems to look very specifically at something more in depth. And, you know, when we look at this, a lot of the screening and prioritization work we do is tier 1, as you would expect. We're trying to do more where it's actually used. I mean, in the agency, we haven't based a regulatory decision just on new approach methods yet. And that's a goal, right? That's something we want to do. Our pesticide group has done more with new approach methods than our TSCA group has. But that's just, they're sort of advanced and they are in a different situation the way the regulation works. Like they can ask people for data. TSCA until the Lautenberg Act couldn't. So it's a little bit of a different place where they can go out to someone and say, this is what we think is happening. Do these assays and let us know. And so we're using a lot of NAMs there where they're recommending the use of a new approach method as in place of the animal study. And so, and a big area for them right now is developmental neurotox. We have a lot of research going on with that in our group. And we're working with the pesticides office because they're trying to find a way, because the sort of animal models for DNT are not necessarily a gold standard, let's say. There's a lot of questions. There's a lot of uncertainty there that, you know, depending on who you talk to, there's a lot of debate in the field. So how can these new approach methods fill in gaps and inform those uncertainties and be used for regulation? And so we just had a science advisory board review. I'm sorry, science advisory panel, which that difference may not make, it's a different office, but where experts came in and weighed in on our DNT methods using these new approach methods and what needs to be done next. And that report just came out. And so where we know there's limitations, we know that there's more work to be done, but it's helpful to get that input from outside experts that come from very different perspectives. But so that's an ongoing effort. And then this, I have this link here about the PFAS count. Actually, that shouldn't be that link. I apologize. It was supposed to be the paper. So I can send the paper if you want. This is from a 2019 paper by Rusty Thomas et al. And it was our CompTox strategic plan for the next 5 years for what we were going to do with the EPA. So it touches on a lot of what I'm talking about, but with a lot more detail. So bringing it back to PFAS, which is what everybody cares about, right? So one of our, so again, I'm assuming many, if not all of you, are very familiar with the federal government sort of strategic action plan. EPA has a strategic action plan for PFAS. So where we're applying our work in my division, so this isn't all of ORD. Chris Lau would have talked about some of the other efforts that are going on, I'm sure, is, you know, the data gap on lack of human toxicity information for PFAS. And so, you know, sort of as I just mentioned about the developmental neurotox for pesticides, where can we use the NAMs that we've developed or develop new NAMs to inform the data gaps that exist for so many PFAS compounds, right? So we are using sort of the in vitro high throughput tox and then also the toxicokinetic testing to fill in these gaps and to support at least prioritizing which ones the agency needs to focus on. Ideally, we want to bring that into the risk assessment realm, and we're working on that as well. Trying to develop, largely doing the high throughput transcriptomics, using that as a point of departure, again, with caveats of uncertainties, but saying this is the activity, the bioactivity we see with these compounds. We should probably be concerned about this. I mean, that's basically in a nutshell. You know, we use a lot of different legal words, but and then this would inform sort of the hazard characterization and then also dose response for those assessments. The thing about PFAS is obviously, other than, you know, PFOA, PFAS, maybe one or two others, there's like no data. So this is an area that is exactly why we wanted these new approach methods. We can quickly, you know, screen them for transcriptomic activity. We also have a cell painting assay that's amazing, and it was published, where it's, you know, each well comes up with 1,300 endpoints, where it's looking at cell morphology and cell size and structure changes and all these different things. And again, it's a huge data lift, so we're still working on how to analyze that. But if you see that, oh, this seems to impact the mitochondria, we don't know why. We're not going to know why. But then what do we test next to say this is important? One of the areas that sort of a continued data gap is the immunotox from PFAS compounds. And so we're talking about, there's some work that the National Toxicology Program was going to be doing on looking at immunotox from a certain set of PFAS compounds. And we're talking now about sort of brainstorming on what could we develop as a new high throughput assay for immunotox. And immunotox can be tricky, obviously. So, you know, we may not be able to get a high throughput, but if we can develop something that we could use as a screening tool, that would help. And the risk assessments that we just did out of the EPA for PFBS, and the other one, I don't think that one's final yet. And the other one that was final was pulled back, and that could be a whole other conversation if you guys noticed that on the website. I don't know if you followed that, but it was removed due to political interference that was a scientific integrity issue. So stay tuned, we'll release that again. But one of the main uncertainties that we went back and forth about was the immunotox. Like, we gave it an uncertainty factor because we pretty sure that it has immunotox effects, but we can't describe them. We don't have the data for that. So we usually add an uncertainty factor, and we're getting pushback on that, that's just being overly conservative. So being able to inform that would really help on not only PFBS, but a lot of other compounds. So, so we're still doing, risk-based testing strategy with the high throughput results that I mentioned. The due dates, that's just how we roll with the orders. We are reporting on bioactivity analysis, which is, the in vitro assays that I mentioned, one of which is on immunotox. We haven't gotten the data back yet, so I'm not sure what we're seeing there. But then there's also on some developmental neurotox and some other things that we're testing there. And then doing, the categorizing the different tests for read across, and then the bioactive dose level, trying to develop these new approaches. And then finally, that stakeholder statement is that they'll have information that they need to make decisions, with always the caveats of what are the uncertainty levels. So, and this is just an overview of, and I wanted to include the link to the actual EPA research action plan, but none of this is a shocker, right? We're trying to understand toxicology, exposure, assess the risk, and identify treatment and remediation actions. Again, my group is focused a lot more on the toxicity, understanding. ORD as a whole is focusing on all of this, but for the division that I run, it's that. And then more information, is that where I ended? Yep. So more information, this is a lot of links to a bunch of different things that might be of interest, some of which I talked about today, like the dashboard, PFAS, NAMs, and then the federal government NAMs. I also wanted to include EPA careers, because there's, I think, am I sharing my, let's see if this opens. I think I'm not sharing the link. You're just still seeing the slides? Yeah, so check it out. There's EPA career information there on both internships, which are sort of on hold right now because of COVID, because we're not really on site fully. But, so there probably won't be any summer internships this year, unfortunately, but in the future. So internships, careers, USA, beyond USA jobs, but just looking at different job opportunities and different mechanisms to work at the EPA. So I talked a lot. And then this is snowy DC, I think, for my questions. So that's headquarters up in DC a couple springs ago when we had snow and daffodils. So, and I think I had, this was just that, I wasn't sure if I was going to need it, but this was that matrix I told you about, where sustainable and healthy communities, we have all of these sort of overarching activities, that's how we strategize our research for ORD, but we'll get out of that. We'll leave there. Anyway, questions, comments, anything I didn't, Alicia or Angie, anything I didn't touch on that you wanted me to?
No, thank you. It was very, very thorough. Thank you. No, I think I just want to open it up to the students and see if they have any questions to the trainees. Trainees, do you have questions? You can use the chat bar too if you need to.
I don't know if I see chat in the same way.
Maureen, I can kick us off with
Okay.
some questions, if that's okay.
Yeah.
So thanks for this. I really wanted to just kind of talk a little bit more about the NAMs, especially for PFAS. And so you hit the question or the point that I think all of us are familiar with, is that we don't know anything about PFAS. Like, there's 9,000 of these chemicals, and we don't know anything about them, and maybe a handful we know something. So do you think that we know enough about PFAS to apply these NAMs? Because I remember, I believe it was, I'd have to find the news story, but it was someone at EPA said that the list of 150 PFAS was had to be trimmed down from 150 to about 130 because the physical properties of the PFAS, when they arrived at the lab, they weren't in a form that y'all expected. So, and I think that kind of adds to the point of, we have like industry that is not being forthcoming with this. So do you think that we know enough about PFAS to use NAMs? And do you think that using a group of 150, which is now 130 different chemicals to represent 9,000 chemicals is enough with NAMs. So that was a big question. I might have a follow-up.
It's a lot to unpack. So a couple things. So I should have done the org chart for the center. So my colleagues in one of the other divisions, that's their focus. That's who determined, you know, what the 150 would look like or the 120. And when they came in, it wasn't so much, I want to touch a little bit on the industry, you know, trust aspects. They are clearly there. And I fully accept that. Part of it was just, we couldn't solubilize them. Like, it wasn't so much they didn't send us what we needed. It was just, it wasn't going to be usable in our systems for our NAM assays. We're also working on that. We got a lot. I don't know how these 80 people that I work with do so much, but they're amazing. Where we're trying to be able to adapt it so we can use some compounds in, you know, DMSO and water and different media. That's a sidebar. But so the way those 150 and then now 130 were selected was, you know, Ann Richard and Grace Patlowitz and a few others who had examined in depth the chemistry of the PFAS compounds that we had structures for, that we knew about, and then where we could categorize these, and then that would be the most beneficial for read across, so that with these, oh, there you are. Sorry, Drake, you moved around, and so I was trying to find you on my screen. So with those 150 or 120 where we ended up, or 130 where we ended up, there was a lot of effort put in to select those to reflect or represent different categories of PFAS. So while it may not be the full 9,000, they were specifically selected and designed for use to be able to give us information on many more than 130. I know there's a paper out on it. I don't have the number in my head, but I know Grace, if I asked her, she could probably tell me. But it won't cover all of them. But so they looked at what is the broad expanse of what structural aspects we wanted to make sure we covered in some category or another. And that's how they tried to adopt that. So the thinking would be that with the data we'll get from the high throughput work and some of the in vitro assays, we could then expand those conclusions using our predictive models for either QSAR or for the read across work to address, again, with the caveats of uncertainties, to address a bigger body of the PFAS. I would say part of, it's not so much a struggle, is that there are so many, and how many we can screen quickly and then maybe target in and say, so if the ToxCast, the in vitro assays that we ran for, immunotox or the DNTs, if we get a couple of those 130, sorry, the number changed a lot. That's why I keep jumping from 120 to 130. If we get a couple of those that are red flags for us, then we can propose to do some traditional assays to really inform that. I know the EPA had a memo out in 2019 about reducing animal usage completely by 2035. I don't know that timeline is realistic. There's going to be times, there will always be exceptions. And so this PFAS may be one of those that's an exception that we have to go back to whether it's animal studies or not, but traditional assays to really finally fine tune what that answer would be. Was that I feel like I missed a piece of the question.
No, that's great. I actually am kind of relieved to hear that last little bit, just because the NAMs scare me from a regulatory perspective, just because I don't understand when we're going to be there, if ever. Yeah. As much as, like, I understand completely the mandate to get away from animal testing and of course the ethical issues involved with that. It's just, I worry that we get away from EPA's overall mandate of protecting human health and the environment if we don't have accurate data. Not that the NAMs won't be accurate, it's just, and I know you've probably heard this before. And I guess my follow-up question to that too is, if EPA is lacking so much data for PFAS or for any chemical really, why not use the testing authority under Section 4 of the 2016 TSCA Amendment to issue those testing orders to fill those data gaps? And that way it's not taxpayers paying that, it's the industry paying for that. And I know you're probably not in that decision-making realm, but I'm not in the
decision-making realm, and I can't speak to, I work very closely with them. And I know it's a frustration on a variety of levels. A lot of what you're saying are a lot of the questions we've been faced with across the board, as far as we have a lot of collaborations and different groups. One of the projects that I've led for a couple of years is this Accelerating the Pace of Chemical Risk Assessment, APCRA, where we brought in regulators from around the world and said, when are NAMs good enough? Like, what do we have to do to answer your questions and build that confidence? And it's going to be a while. And, you know, when that memo came out, there was, you know, push pull, right? There are people that are like, yay, no more animals. But there was the same point you had. Are we still protecting public health appropriately? Not to get too political, because I don't know where we're going to go with this, but we are in a new administration, and that memo was a directive and not a mandate. So there may be shifts, and you can imagine it's under discussion with the new appointees that are coming in. Like, what are the best parts of that we might want to keep, and what are the things that are maybe not realistic? So watch the space. I would say watch the news once we get our appointees confirmed, hopefully next week. So I think as far as the requests for assays, and that's been a question that's been asked of the TSCA crew, and I don't know how those decisions were made and how they might change in the future. So again, I can't really speak to that. But it is a good question. It's also, I mean, I will say that they were under the gun on trying to get those things done in 3 years. And that may have, like, working on things like asbestos and that they didn't really need. I mean, that's the existing chemical side, but that was pulling a lot of resources and time. And so, not to be an excuse, but I don't know what the process was for new chemicals versus existing. They have also just gone through a reorg related to the Lautenberg amendment, and what, like, trying to be more efficient in how they do the work there. So I think that we might see, for a variety of reasons, we're going to see a lot of changes coming out of there. They're hiring a lot more. They got a lot more resources. So hopefully we'll see more movement there. But I mean, it's a valid question, and you're not alone in asking it. So.
Thanks, appreciate it.
Yeah.
Anyone else have questions?
I'll speak a little bit to that sort of building confidence, and where Drake was saying, where, you know, he thinks they'll be good, but when are they good? I mean, that's our job, right? That's what we're dealing with constantly right now, is how do we build that confidence? And so one of the things out of that memo on reducing animal use was the need for us to do an annual NAMS workshop for public input on what we're doing, and for us to present. And it's on the NAMS link that I have on the end of the slides. Hopefully you're going to get the slides. I think Alicia was going to send them around, but if not, I can send some stuff. But so we wrote a NAMS work plan, we made it short and sweet, saying these are the high level things we need to do for NAMS to make this a go, right? And part of it was things related to EPA, where it says, you know, what are the regulations that require animal testing, and where could we use a NAM instead? So that important to us, maybe a little bit more dry for the public, but also there were things about how do we build the confidence? What's the scientific confidence framework we need to create so that people say, I trust this data as much as I would trust an animal study? And that's a key area of focus for us. But that's a big part of that sort of NAM work plan. And so we've had 2 of the annual meetings. The first one was really, it was really sort of an overview of what EPA had done, and then what a few of our partners had done. Full disclosure, we had 2 months to make it happen. And so we were like, okay, we got to do things that exist, right? Like, set the stage, it's foundational. Let's get this conversation started, but not really explore. We had some discussion groups, but the presentations were a lot more like, this is where we think we are. This is the foundation of NAMS. And then the discussion groups were more, this is where we could maybe go, and what are we thinking? This year's meeting, I think, was more, these are the cutting edge ideas we're working on, and what do you guys think? And so that was a little bit more, I think, exciting and interesting. But I mean, I can say that I planned both of them, so I can insult one by being nice to the other. But that's all linked, like the final reports and the slides and everything are linked on that website. But all of those points are things that we're grappling with, and it's really, some of it is just making people understand what NAMs are. So I spent a lot of time trying to do that, is like, this is what they are. Then a lot of, you know, QSAR is not new, right? We've been using it for years, and they've been using it in regulation for years. It's not something to be afraid of, right? But finding that balance between making sure where the NAMs we're developing are conservative enough to make people be comfortable in using them, but not overly conservative to make people be uncomfortable in using them because you're over-regulating. So we're working on that balance. Anyway. And spur any questions, I could throw a word out there and see if it's a word cloud.
So I had 2 questions for you. One was just, when did you have an opportunity to learn risk assessment? Because it sounds like you had a biology degree. So was it completely on the job? Did you take any training?
I
And
did it
then
on
my-
the job, and it was, there were some training courses that EPA had. They weren't like a course. It wasn't a semester. I will say, as I learned risk assessment, I wish I had had a course before I designed research, because you would design it differently. In my mind, you would design it differently to be used for risk assessment. And that was something, a few years back, we had a meeting with academics and risk assessors saying, a lot of academics were like, why don't you use my data? It's good data. And we're like, well, you don't have enough doses, or you don't have, like, there are things that if you haven't done the risk assessment side, you don't know are sort of required for us to get the confidence of our reviewers. But yeah, I was on the job, and then I worked with some great people. So that was what it was. You had another question, sorry.
Oh, no, then the second one I put in the chat bar was, just aside from protein binding, what other assays do you think could be informative to help predict PFAS toxicokinetics? Because I think a lot of the times we can slap them into cells and see a toxicodynamic effect and have a really good sense of whether or not a new PFAS behaves like a, PFAS or PFOA. But any ideas about other assays that would help inform us about kind of the pharmacokinetics side of the molecules?
That's more of a reach for me on the TK.
Oh, okay, sorry.
But I will say that we have my sister division, or my brother division, I guess, since it's led by Mike. I don't know if you guys know Mike DeVito, just from his past life. He's been working in the field for quite some time. He's the division director for the group on chemical characterization and exposure. So the high throughput toxicokinetics group there is working really hard, not only on PFAS, but on other compounds, on how we can do some high throughput screening and predictions of the TK for PFAS and others. I don't know enough. I'm sorry. I don't know where their brains are going. Actually, we just drafted a strategy for the exposure side of the house on PFAS, and I haven't had a chance to read it yet this week. So I apologize. I could have been much more informed for you. But if you want me to drag Mike in to have a talk with you guys, we could probably do that too. He's a funny guy. I've never met him, but brilliant. And he was at EPA for many years, went to NTP, and now is back at EPA with us. So, but.
Okay. All right, trainees, any more questions?
Yeah, I'm not seeing chat for some reason, because I don't know what I'm doing probably. So if there's any questions in that.
I have just one more simple question. I promise this is way easier than my other ones. For as far as NAMs are concerned, are zebrafish considered animals? Under
are you like a spy in our offices or what?
I did. Full disclosure, I did used to work at EPA. I used to work with Tamara and Stephanie a lot.
Oh, okay. All right. Stephanie's in my division. So yeah.
Yeah. I was in Tamara's lab.
Tara would be, but she abandoned us, so she's not. No, she. So there was a lot of discussion when you look at the memo about animal reduction. It's very clearly not talking about animal testing. It's talking about mammalian testing, and they were going a lot about when is a zebrafish considered, when or if is a zebrafish considered a mammal. We've dodged it a little bit. We consider it a new approach method because it is largely used before it would be considered necessary by some, before it would be considered as, a mammal. But we had to go back and forth about that as to where does zebrafish fit. And then also some other things, like when we're using, a lot of our D&T work is based on rat cells from a pregnant rat. And it's like, so it's, the assays are not on an intact animal, but there is still a rat involved. And so we had a lot of discussions about where that cutoff would be. I will say for NAMs, we don't have an official definition. The one I didn't show it here. The one I usually use is where it talks about avoiding the use of intact animals, is in our alternative toxicity testing strategy document for TSCA. And that was a lot of wordsmithing, a lot of these sort of discussions, like, if you say no animals completely, does that kind of cut out zebrafish? Does that cut out, the D&T work we're doing where there's a rat involved, right? So a lot of nuances there, but EPA does not have an official definition, so we have some wiggle room. ECHA's definition, the EU's chemical agency under REACH, theirs is much more flexible. They're like, we'll take pretty much anything under this umbrella of NAMs. So that hasn't been fully finalized, which there's a reason for that. That gives us the flexibility we need. So.
Gotcha. Thanks. No, that makes sense. Yeah, as a zebrafish person, I wanted to
You still have-
be clear, but it's still like not clear even for us sometimes when people talk to us, like we're like, well, you don't have to feed them until they're vertebrates, and they're not vertebrates until this day. So it's a
Well, and that's what we talked about. We were going to talk about only vertebrates, and then we ended up on mammalian, which I thought was strange anyway. And I was like, okay, but yeah, that again, the joy of being in the government, right? Wordsmithing down. And I don't think it's just government, but it just feels like sometimes it is.
absolutely.
Well, and so the slides have a bunch of links in it. I'm always happy. I think you hopefully have my email if you want. I have a lot of meetings, so usually email responses are nights or weekends, but I try. And if you don't hear from me, bug me in another week or something, because I'm fine with being nagged. I'd rather not miss responding. But yeah, any questions and about jobs and things like that. I like I said, I fell into EPA because it was a good start into acronym soup in DC, and I really, the mission is very important to me. And so, I guess you guys can only see this too. Oh, and dental research was genetics of periodontal disease. It's part of the dental school. Other people did virology and microbiology and different things that dentists have to deal with. And then the kitty was Clark, as we know. So thank you for the hi to Kitty, because he's very social.
Maureen, I have a last question for you.
Sure.
How is it difficult to navigate through the political changes that go through EPA within every administration, so you can keep doing the research as you're planning on doing it?
It depends on the factor, right? Like, I mean, it depends on what you're thinking as far as difficult. I mean, there's every new administration, whether it's a change in political party, has their focus. They have their like flagship. We went through green chemistry with one guy under Obama, and then it was sustainability with the next person, which was similar. Then it was climate change. So you have those shifts in focus, which you just get used to sort of dealing with. I would be lying if I didn't say the last 4 years were probably the toughest I've been. I've been in the government since 2000. So, and a friend of mine who just retired was here for 40 years. And he's like, I thought Reagan was bad. Like this, it's crazy. So there's that element of sort of decreased resources, where often we don't have a huge budget. I mean, the EPA doesn't get a lot of money. Like it's for what we're able to do. It's always shocking to me. And my friends in the military, they're like, that's our training budget. Your full budget for EPA is what we get for training. So that's a difficulty in terms of trying to figure out, what you're going to be doing as you transition, if you really think that the resources may be cut and the budgets may be impacted. What I'll say is not difficult. What I've found is the mission stays the same. The focus may shift, but the mission always stays the same. So everything we're doing is to protect public health and the environment. So even if, so like Secretary Regan's going to be very focused on, from what I can tell. So he's Secretary Regan because he's the secretary here of the Department of Environmental Quality or Protection. I can't remember which one in North Carolina. But if he becomes the administrator, very focused on environmental justice, children's environmental health, some on the sustainability and some other pieces. NAMS is not something he seems really in tune with. He's not against it. We haven't had that, but we have to have that conversation and say, is the focus there going to? Last administration loved us. Like we were probably the only part of science that they liked, to be blunt. But that could be an impact on our resources. But what we do is fulfilling the mission. So it's not going to go away completely. So there is sort of an ebb and flow that you get used to. And I will say, again, I work with a lot of great committed people. I mean, I don't think most people don't come and stay at the agency unless they really believe in what we're doing. So you sort of find a way to do that. Yeah, but it's a good question. It is something that took me a while to get used to. And when I was CDC, non-regulatory, very, very different, because you feel like you're still impactful. I mean, I do think the work CDC does is great, but the research I was doing on occupational safety wasn't for OSHA. It wasn't political. It was, this is a science need and it will help inform them, but it was so many steps removed. I mean, now what I do, like the number of times that even worse when I was doing risk assessment, you get emails or calls from interested parties, whether it was the community impacted or the industry impacted, saying, what you're doing is wrong. And you get both sides. Both people would say you were wrong. You can't make everybody happy, right? So you know, we commit to what we're doing because we want to do what we can to protect public health. And I know I have rose-colored glasses, but that's what gets me through. So that you have to consider that doesn't change, even if the focus shifts, right? So, you know, I'm happy that we're going to be doing more on EJ and Children's Health. That dropped off the last 4 years. We did a lot of that 5 years ago, and it sort of waned over the last administration. I think it'll be great to get back to that. What I'm doing will have my, you know, the NAM work, not really tied into that, but that's okay. Like, we'll still keep going. So hope that helped. All right. Well, it's been fun. Hope you enjoyed it.
Thank you so much, Maureen,
Yeah.
for talking about yourself.
I love it.
Thank you. Thank you so much for your time. Thanks for, you know, all of the information and the career information. Trainees, thank you for attending. I hope you're enjoying kind of learning about the different career paths and where they lead people. So with that, it's 12:03. We've been doing this for about an hour. So thank you guys. Maureen, thank you so much. Alicia can put anyone in contact with Dr. Gwinn if you can't get to her email, and she's sending out the slides. So everybody stay warm and safe, and be careful with the snow. And Maureen, thank you again so much. Thank you,
No,
Alicia.
thank you.
Too.
Thank you for the invite. Thanks for setting us up, and thanks for the interest. Bye.
Yeah, thank you. It's great. Bye.